The next thing we're going to talk about is we're going to talk about comparing our healthcare system with other countries' healthcare systems. And one of the things that you notice first off is ours is very much based on an individual incidence of care. So we have public and private. Most of you probably have private, where you go to an individual physician that your insurance covers and covers a percentage of. Usually you go based on incidences of health. You have a doctor that treats you. We also have what's called other types of insurance. So we have government insurance. So that could be Medicare, which is for people 65 and older. Obviously, they are sicker and have more comorbidities. Then you have Medicaid, which is for people who qualify and who are poor. And that's a lot of women and children. And the government pays for, again, incident-based health issues. Then you have the SHIP program, which is for children, and that's for children who are they qualify only, not their parents, because they're a little bit above the Medicaid line of qualification. Then you also have things, for instance, you have the Veterans Administration's healthcare system. So about 30 to 40% of our population is covered by those health insurance, those government-sponsored health insurance programs. The problem is that we don't get really great outcomes, in part because a lot of those systems do incidence-based, including private, what we call private health insurance. They really look at incidence-based. So they come in, you have a cold, they treat it. You come in for your annual visit, they say, how are you? You go fine. They do some tests, they're done. They're not really looking at the whole person, and they're not really building in preventative health into the system. Doctors in almost all of these systems, or healthcare providers, nurse practitioners, people such as that, are all paid based on the visit, not based on outcomes, also not based on preventing things from happening to you, and based on treating the whole person. In this way, other countries do a much better job. They actually don't just depend on your employment or your government per se to only pay for people who are very sick or very poor. There are other healthcare systems that have comprehensive healthcare financing. So for instance, Great Britain, there's a tax system which goes towards giving everyone access to healthcare. Built into that system is a system of sort of public health. So when you go in, they're very focused on also providing preventive health, so they will look at diet, weight, exercise, risks, and they will not get just paid based on making sure that you get better from your cold, but making sure that it's not related to allergies and making sure that you have fewer colds over time. So they're sort of paid whether you are sick or not, but they're also paid to get better outcomes. We are, up until maybe the Affordable Care Act, we didn't really have a system in place that treated the whole person, that looked at prevention, and you got paid for prevention. So now your doctors in some plans will get paid for making sure that you have all your immunizations, including your flu shot. They'll make sure that they'll get paid extra money if you quit smoking, if you maintain a healthy weight, if you do all of these things. Now that payment for those outcomes means that you have different incentives built into the system, and means they're going to focus on different things. And again, we talked previously about non-communicable diseases, and that's what we're trying to do, is make sure that those don't happen, and if they do happen, they happen later. But one of the reasons that you're going to get those better outcomes is because you're looking at preventative health and you're paying, reimbursing based on those outcomes, not just based on you're sick, you go in, you get paid no matter what happens. Other healthcare systems have that built in. They get paid based on the patient's outcomes, but everybody gets access to healthcare. So you don't have people who are undertreated. You also are not going to get people who are overtreated, because one of the reasons they come up with what drugs people get and what kinds of treatments they get is very much based on the public health model. So what works for the most people, not what might work for you if everything else doesn't work for you, or what you get is based on what your health insurance will pay for. But it's looked at a community level. It's looked at what impacts and what's most impactful for your community or for the country, so that they spend the money wiser based on outcomes, not just based on what you want or what's on the market that you can buy. So it's very much a social market versus a market system, and a social justice system, I should say, versus a market justice, which really isn't justice, system. You get access to it whether you have money or not. They want everyone to have the same outcomes, but also sort of built into that, and one of the things that the book doesn't really talk about is there's a culture. The culture that you want everyone to be healthy, the culture that you feel like some of your tax dollars should go to making everybody healthy, that there's a minimum standard of healthcare that everybody should have, sort of a human right that everybody should have access to, which in the end also means that you pay less for people who don't have access to healthcare and who get sicker, and you may either have to support because they can't work, or you may have to pay the medical bills because they're not getting the best care. You still have to pay for the medical bills because no one's reimbursing that. And they're also saying that a whole group of people are not written off where, oh, well, that's what happens to them, because they want to make sure that everybody has a minimum standard. Great Britain's like that. Germany is like that. South Korea is like that. A whole lot of places. Canada is like that. A lot of the very developed world has a healthcare system in place, but it is embedded within the public health system. Our system is very different. We have individualized care, then we have a public health system. And the public health system is also paid for through tax dollars, but your public health system is again based on where you live. So we might have a great public health system because we live in Cook County for the most part, or we live in a richer place where there's access to tax dollars so that we can make sure we have safer water, and we can make sure that our air is clean, and we can make sure that we have access to health and that we have healthier people. If you live in a place that's not as rich, then they're not going to be able to monitor your water as well. They're not going to be able to make sure that policies are in place to protect you. So in America, it is very much the market lack of justice, but the market justice model that does impact even public health. Now, the question one should certainly think about is that fair? Is that what we want? Or do we want more financing for public health so that everybody can get better? Do we want more of a marriage between public health and actual individual health so that we can have a minimum standard of health that everyone should be able to obtain? We want to make sure that we provide people with the tools and the technical know-how and the just resources so that they can all live a healthy and happy life no matter where they're born, so that everyone has access to healthy, safe water without lead, whether it be in Michigan or New York City or Chicago. We don't necessarily have that built into our culture. Our culture is very much about the individual. So one of the things I want you to think about when you're reading and when you're thinking about making health policies, you have to think about the culture it's in. We've talked about that. And if the culture is very individual based, then you have to connect that culture up to it will save money, it will help people, it will do something for everyone as a byproduct, but it will also help specific people as a first product. And that is a really hard idea to understand for other countries, because that's the opposite of what they do. The opposite of what they do is they say, we're going to make sure everyone has a minimum standard so that we can get great outcomes and save money, and that people can work healthier, happier, longer. We'll have less negative health outcomes. We'll be able to see, based on having one budget, what works the most, because we can collect the data and see what works for the greater good for the most people. We can also see if there's new incidences in health. For instance, in places like Great Britain, your government helps pay for your medical school so that they can say to you, we need more family practitioners. That's what you're going to go into because the government's paying for you. So they don't have as big a doctor shortage, although there's a much bigger doctor shortage worldwide. But they can also build that into the system to react and respond because they actually collect it and they know what's going on. Versus this insurance in America doesn't talk to this insurance, so we have no idea. If we didn't have the CDC where doctors are reporting stuff directly to them, we'd have no idea what the disease process is. So we need to make sure that we sort of impact that policy, change that policy. Some places are doing it. Kaiser Permanente is sort of saying we can save money by insuring these people if we make sure they get the best outcomes. The best outcomes in the long run will help cheaper, better health for everybody, and we'll make more money. So if you can find a way to connect public health and preventive health and making the population healthier with saving money, because that's what a market justice system is about, and do it from an individual expanding out to a group population, that's what you have to do in America. Again, just like when you're doing a health intervention, you have to think about the culture, you have to think about the constraints. But once you know the constraints, then you can be really innovative with the solutions. That's one of the reasons why the Affordable Care Act makes everybody pay, so that we don't have free riders, because we know in a market system, you're going to have somebody that goes, I'm going to listen to public radio and not pay. That's a free rider. And we also know that if people who are really healthy pay, that will help offset the cost of people who are not so healthy, which is one of the reasons why they made sure all the younger people in this class are added onto their parents' health insurance policy, because that help offsets all the people who are sicker. So you can do policy innovation, you can make changes in healthcare, but you have to understand this cultural constraint. And then you can change everything for the better.